Hi, my name's Kristina Key. I graduated from the University of Lincoln in 2013 when I did the BSc Honours Health and Social Care degree. So I work for Lincolnshire Partnership NHS Foundation Trust as I'm part of Lincolnshire Talking Therapies. My role there is an employment advisor. Now most people would think, well, why would an employment advisor be working in therapy? And I can understand that, but basically what our service does is it helps people with mild to moderate anxiety and depression, or maybe experiencing stress as well. And they can refer themselves in either by self-referral on our website, or they can go through their GP to be able to get referral across to us. And they can receive therapy from one of our psychological wellbeing practitioners, cognitive behaviour therapists, interpersonal therapists, or one of our counsellors. And they can get things like guided self-help, or they might go on a low mood course or a depression sort of related course. And then at the same time, they could also get referred to us as employment advisors. When they're referred to us, that could be because they are unemployed, so they might need help with things like CV writing or interview skills. But it could be that they're in work and struggling for one reason or another. Maybe they're off sick and they're struggling to return to work, or maybe they're in work and having difficulties with making reasonable adjustments. So they get that insight from all of it, and so that's when my role comes in. My degree has supported my career because I use health and social care day in, day out. I'm working with people that have got mental health problems going on. And so, of course, the things that I learned on this course was all related to that. I learned about the different disorders that people can have, extra health conditions that people can have. But then once I left university, I also went on to get a teaching degree and then also a master's degree, both of which were in education-related topics because I was teaching for a while. And of course, my teaching plays into what I do within my work because we do run employment workshops. We're talking to people every day and teaching them new skills. And so all of the degrees that I've got play into what I do in my job. My Lincoln experience was amazing in its own right. It was probably very different to some other people that came onto the course, and that was because I ended up living at home. I only live just over 45 minutes away from Lincoln University. So I was able to commute backwards and forwards, but I needed to be able to do that because I was originally meant to start university in 2008, but I had to delay that to 2010. And that was because I had a head injury that meant I experienced stroke-like symptoms. So I lost the ability to read and write. I lost all talking ability, my hands clenched up in fists. I was in a little bit of a mess. So it took me 2 years to recover and have to learn to read and write again. So I had to get involved with the disability team at Lincoln before I even started because I was going to need some support if I was going to be able to complete those assignments. My brain was still working properly, but the way that I wrote it down was not. So we needed to come up with ways to help with that. And I can't fault Lincoln for the way that they supported me. And that included the lecturers on my course. I can remember that I was having difficulty hearing one of my lecturers because it did impact on my hearing as well. And so they made sure that I'd got recording devices to be able to do that. You know, they tried to come up with different ways of doing it. So I had the best experience and they tried to make sure I was as included as I possibly could be. The main reason that I started to study at Lincoln at the time was because health and social care was not necessarily a topic that was taught at every university. So it was quite limited, but then at the same time, it was still close to home. And I've always been a family orientated person. And so I wanted to make sure that if I was going to go to university, it was not going to be somewhere that was too far away. Originally, I'd intended to come and stay in the student accommodation. It wasn't the fact that I intended to stay at home, but obviously that changed when things happened with my head injury. So I ended up staying at home. Did it change the way that I actually did things at university? No, not at all. Did people treat me any differently? No. It made no difference in that sense. And I still tried to connect with my peers as well outside of sort of lecture times as well to make sure that I was just as included as they were, even though they lived here. I think my favourite thing about Lincoln is it's such a beautiful city, and I think actually the university is incredibly modern, and I think all the new buildings are just adding to that in every single way. So to me, the look of it was also a big thing for me. I wanted to feel comfortable in the environment I was in, and I felt comfortable here. But then also, I mean, I went to several open days before I actually decided on where I was going to study. And there was some that I just felt a bit more uncomfortable with, whether it be the types of lecturers that I was meeting or whether it was just the type of university it was. you've got to feel like you're at home. If you don't feel comfortable in where you're studying, then you're not going to do it to the best of your ability. And so that is exactly why I ended up staying at Lincoln. I think if I was giving any advice to new graduates is don't be afraid to change your mind on what career you want. When I left university, I said I was going to be a health and social care teacher. I did that. The only problem was I found that I wasn't the best when it came to behaviour management in schools. It wasn't something that I was really that fond of. I loved teaching, but not so much that part. And so after a few years, I was like, it's time for me to change. And I don't think that was a bad thing. We can go in with one particular mindset, and that's great, but it doesn't mean that we end up loving it. So why not try out some new different things? Look at your different passions, whether it be you were looking at domestic abuse, or whether it be that you were looking at homelessness or alcohol dependency, or whatever it may be. You can find organisations that actually relate to something that you're interested and passionate in. And when you find that is actually where your best forte is probably going to be. So you can look at things like charities and things like that. So there's a broad range of different jobs that you can do within the health and social care sector. And that's why for me, I came out of work after teaching, and I ended up going to the job centre on benefits. I wasn't feeling very well at the time. I'd had another back injury, and they ended up putting me on something called Work and Health Programme. And that was a government funded project, but it really did support me, because the advisor that I had there said, "You want to help people, right?" And I said, "Yeah." And she says, "Why aren't you doing my job?" I'd never have even dreamed of doing her job. But I tell you what, I ended up going on and I did the JETS programme, I went and did their work and health programme as well. I did all sorts of other things before I came to work where I am now with Talking Therapies. But actually, I'm in the best job for me. It's not the job that I originally imagined I was going to get, but there's a lot of jobs out there that you don't know exist. So be a bit more open-minded about it. I think if someone was thinking about coming to university, I would say make sure you choose a topic that you're passionate about. If you are just doing it because you think it's going to make you lots of money in the long run, then to be honest, you're probably not going to enjoy it and you're probably not going to stick at it. So just make sure that you're choosing an actual course that is right for you based on your skills, your talents, and also your passion. And I think that's got to be the big thing there. And also, if you don't know what you're going to be doing when you come to university and what you want to do afterwards, that's okay. You don't have to have all the answers at the time that you come to university. You can work that out later. You can even work that out after you graduate. So I would say, yes, make sure you come to university if it's something that you really want to do. But at the same time, try and make sure it's that topic that you feel is going to be right for you.